Hello everyone, I'm Dr. Barry Swindler. I'm a chiropractor in Wake Forest, North Carolina. And for those of you that want to reach me, you can find my information here on this side, my website, my address, phone number, etc. You can also find me on Facebook as well, where you're going to see this video and other videos I've done. Today I've come to talk to you about high blood pressure and low blood pressure, the causes and treatment. There are a number of my patients that asked me to do this video, so I'm doing it now after success of dropping their blood pressure and raising those ones that were very low. They asked me to do this, so I am doing it. I'm going to be going over the causes and treatment of high blood pressure and low blood pressure. High blood pressure is known as hypertension. It's usually diagnosed if you have a blood pressure of 140/90. The top number, the 140, is the systolic blood pressure, and the bottom number is the diastolic. Some people call my office and ask me do I treat high blood pressure, or do I treat arthritis or migraines or what have you. I tell them I treat the person that has the condition and not necessarily the condition that has the person. Blood pressure is a prime example of treating the effect instead of the cause, and I focus my practice on finding the cause of a certain condition, disease, or what have you. You treat the cause, the effect will take care of itself. So with high blood pressure, some people do need to be on medication, and I do strongly suggest that if they need to, go to your MD and get that prescription. But at the same time, let's try to find out why someone has high blood pressure. I'll be going over the causes and treatment, like I said today. With high blood pressure, 80 to 90% of the people can be helped. The patient that can't be helped is a person that has a renal artery that is sclerosed. Let's say if this is the normal renal artery, if that is very narrowed, if it's restricted, the blood flow is, there's not much I can do about that, and I refer those people out to something that's called chelation therapy, and that's been very effective for those people. Get back to blood pressure. Normal blood pressure is considered 120/80. Again, 120 is the systolic number, 80 is the diastolic. But that is blood pressure for a 20-year-old. Okay. A better way to calculate blood pressure is to take 110 plus half a person's age, and that's for the systolic, the top number. The bottom number, you want to be under 100, and preferably to be below 90. When a person comes into my office, I take their blood pressure in different positions. I start off with them in a seated position in the left arm, let them sit there and relax for a couple of minutes. I'll take the blood pressure. I'll have them stand up. After they're standing up for a couple of minutes, I'll take it again. After that, I'll have them lay down flat on their back, face up on my table, and take it again. So it's good to take it three different positions. If the blood pressure drops from going from seated to standing, that is an adrenal condition. That's one of the first things I check in my office, especially for a person that's coming in with stress-related conditions. If it does not raise between 10 and 12 millimeters of mercury on the blood pressure cuff or the blood pressure machine, that is an adrenal condition. And that's called postural hypotension for those medically minded people out there. Now also, when a patient is standing and I'll have them laid down, if their blood pressure increases from standing to laying face up flat on their back, that is a kidney condition, and possibly needs to be referred out for further evaluation. When it comes to blood pressure, there's three ways the body deals with that on the hormonal system. In our body, in our pituitary gland, is something that we make called antidiuretic hormone. There's ways to measure that on like a urinalysis, measuring specific gravity, and that is truly what it does. It's antidiuretic hormone. The three words speak for themselves. The second one is the hormone aldosterone that is secreted by the adrenal glands, and this hormone is very important for actually retaining sodium in the body. People that are stressed out for long periods of time, their adrenal glands will kind of just give up, and they'll stop secreting the hormones. When they do, their blood pressure will drop. We need this hormone aldosterone to absorb sodium, so it helps keep you hydrated, keeps your blood pressure up. The third one is something that's called the renin-angiotensin system. We'll just refer to this enzyme as renin. We'll call it renin for now. Renin goes up when the blood pressure to the kidney drops. Whenever there's restriction to the blood flow, do you remember I said I can help people unless their renal artery is sclerosed or has narrowed? Well, this is when renin will go up, and the blood pressure will also go up. Conventionally, if you go to an MD or go to a doctor to get blood pressure medication, they're going to look at two things, whether your renin is up or if your renin is down. If your renin is up, they're going to give you a beta blocker. And when people take beta blockers, they also need to take magnesium. Very important. On the other hand, if the renin is down, you will be prescribed a diuretic. And if you're on a diuretic, you need to take also potassium. Very important mineral. I'm going to go over some of the causes of high blood pressure, and this is what I find a lot in my office. But again, if the cause is the renal artery is sclerosed or narrowed, I will send those people out for chelation therapy. Me being a chiropractor, I treat the nervous system. The nervous system is for our brain and our spinal cord, and we have to think about the nerve supply to the heart. Now look at the upper back for the proper nerve supply, and oftentimes what I find is, I'm just going to point this on myself so you know where it is. Here on about the second level of the thoracic vertebrae is where you'll find, where I find nerve supply. It's the heart, and that area needs to be adjusted. And I've found many times after adjusting that, I have dropped the blood pressure in people. How long does that last? That's the million-dollar question, like anything else. How long does it last? Well, I'll check it the next time. There may be other things that need to be considered, but nerve supply is definitely one of them. Shoulder dysfunction. There's 5 joints in the shoulder, and I go through the shoulder very extensively to figure out any misalignment. But we have nerves and blood supply that nerve come out of our neck, and arteries that go down the arm that come off from the heart. If there's restriction because of a joint being out of place, it's going to pinch on that artery and can cause blood pressure to go up. Another common finding that I find in people is a congested liver. And I use this term or this analogy, people can grasp a hold of it, and that is the liver is like our oil filter in our car. The oil filter in our car has to filter out all the oil. So with the liver, after all the blood is oxygenated blood is delivered to the body, it has to come back to the liver to be detoxified and cleaned out. But if a person's liver is very congested from taking drugs or eating trans fats, just having a bad diet, the liver is going to be congested and become clogged. And when it does that, the blood backs up. And when the blood backs up, pressure goes up. These people also will have varicosities, like varicose veins in their legs and elsewhere in the body. Also people that have hemorrhoids. Also, this is a congested liver, so it's easy to think about how a congested liver can cause high blood pressure because just the system is backed up. These things, some things are easy to find on patients. They'll have a blanching. If you take your thumb and you put it wrapped between their shoulder blades on their back and take away your thumb, you'll see it's blanching. Also, people that have white spots on their hands, that's a congested liver sign. Things that congest the liver are, again, like I said, too many bad fats, especially the trans fats. People that drink too much alcohol, eat too much cheese and chips and that kind of thing, they congest the liver. Also, people that are on medications for a long time, this can congest the liver because, again, the liver has to detoxify everything, and the liver uses a mineral called sulfur to detoxify drugs and other things. So we want to look at the liver for any cause of high blood pressure. Another condition is heavy metal toxicity. In my office, I sometimes send people out for a hair analysis to measure heavy metals such as lead, mercury, cadmium, and others. Heavy metals are very important. They have been linked to many neurodegenerative conditions such as Alzheimer's, ALS, etc. A hair analysis will be very beneficial for let me know exactly which heavy metals there are, and I do have nutrition in my office to help to get rid of those heavy metals that are in the body. Hyperthyroid is a big factor of high blood pressure. That's something that's called Graves' disease, and how that is tied in with the liver is that the liver makes 60% of T3 hormone. If the liver is not functioning properly, it's not going to make the thyroid hormone, and then a person can develop a hyperthyroid condition. Another factor is a toxic kidney. I did mention before, part of the kidney is where the sodium is absorbed with the hormone aldosterone. People that have a toxic kidney, definitely they're going, especially the renal artery that's attached to the kidney. If that is sclerosed, again, blood pressure is going to go up. Anemia is another big factor. You can be anemic to many things. A lot of people here are being having folic acid anemia or B12. There also could be copper. There can be many other things for reasons why people have anemia. Another cause of high blood pressure is allergies. This could be seasonal allergies or it could be a food allergy. And if you talk to any of my patients in my office, they'll tell you that I screen for corn, wheat, and dairy. Those are the three biggest food allergies, and I do that by doing an oral nutrient test, or oral food test, I should say. And it will identify through causing a strong muscle to go weak if they are allergic to that food. And lastly is the feet. If the bones of the feet are out, it can produce biomechanical stress all the way up the body, which will produce high blood pressure. Those are the main causes of high blood pressure. As far as treatment, I treat the person that has a condition, or there's a saying in applied kinesiology called "fix what you find," and that's exactly what I do. If it's the liver that's congested, I have a great detoxification program, some great nutrients to help to detoxify the liver, and also some good home remedies that I'll have people do to help assist the liver in detoxifying. If it's heavy metals, again, I do the hair analysis. If it's thyroid, I'll send out for a thyroid panel to look at the T3, T4, and other markers of the thyroid to see what their levels are. If it's a kidney, again, certain nutrients that I have, as well as treating the patient to try to clean up the kidney to help bring the blood pressure back to normal. The last thing I want to talk to you about is low blood pressure. Not too many people talk about that, but that is very important. And I say in two ways here today. I've had a patient, there was a man that was in his late 60s, and he was having high blood pressure. His ND put him on some high blood pressure medication. It was a beta blocker because the renin was up. But what it did, it was too high of a dose. So it did drop his blood pressure, but it dropped it down so low that the guy was having problems becoming dizzy when he stood up. So I talked to him about having him talk to his doctor, and he spoke to his doctor, and he did decrease the dosage on it. So his blood pressure came back to a normal level, and he wasn't becoming dizzy. He wasn't falling down like he was before. But with the adrenals, adrenals are a big factor with low blood pressure. People that are, again, stressed out for long periods of time, their body will stop making or not making enough of the hormone aldosterone. So any low blood pressure conditions, I'll be looking at the adrenals. So those are the causes and treatment of high blood pressure and low blood pressure. I hope that you enjoyed this video. Again, feel free to find me on my website, chiropractorwakeforest.com. And thanks for watching.